My question is for the Premier. My office has been contacted by many family members confused about the vaccine rollout, who qualifies, where they go, and how their elderly parents or those with language barriers will be able to access the system. York South Weston is identified hotspots and one of the high risk that is harm to many essential workers, many of whom are black and racialized residents that were previously neglected by this government when a local COVID testing facility hasn't even established until late September last year, are fearful they are once again being left behind. What can the Premier tell our community about the vaccine plan to address residents' concerns, and will our high-risk community have local vaccination facilities?
Minister of Health.
Well, thank you very much to the member for the question. This is an important issue. I know many people are concerned about when they will be receiving their vaccines, and they're anxious about it, and we're anxious that they receive the vaccine as soon as possible. But we are vaccinating based on age, of course, as the end of phase 1, people over 80. As we start moving into phase 2, it will be people between 60 and 79 years of age and so on. But it's also based on risk, as I've indicated before. There are some at-risk neighbourhoods within Toronto that will be receiving additional vaccines. There will be some mobile testing clinics. There will be mass vaccination sites as well, but the communications are very important. They have been translated into a number of different languages. That information is available on the website. And in addition, as the local public health units are ready to start vaccinating in different stages of age and risk, that will be notified to the people in those communities in many, many languages. We want everyone who wants a vaccine in Ontario to be able to receive one.
And the supplementary.
Mr. Speaker, back to the Premier. A recent report, Toronto Star Story, outlined more than 350 sites for COVID immunization did not include a single location in high-risk community like ours in York South Weston. I know this government wants to pass things off to local public health, but I urge you to take direct action and leadership and work with Toronto Public Health to leave no one behind and be vigilant when it comes to high-risk communities like ours. I sent the Health Minister and Dr. De Vella a letter outlining a list of suggestions, like vaccinating entire senior buildings at one time. Will the government listen to my suggestions that include local access and accommodation for seniors and others who simply cannot physically stand waiting in long lineups, and create vaccination facilities in my community?
Minister of Health.
I thank the member very much for his suggestions. I'd be very interested in reviewing them because we want to make sure that everyone who wants a vaccine will be able to get one. We are working with Dr. De Villa. I know that Dr. Williams, our Chief Medical Officer of Health, speaks with Dr. De Villa almost daily. That is really important because we want to make sure that we're going to have access sites for people to receive vaccinations in all parts of the province and in many locations. Some will be mass vaccination clinics, some will be in pharmacies, some will be in primary care providers, some will be even mobile test units for some of the communities at risk. So we are working with Dr. De Villa. We are working to make sure that all of the information is translated into many languages. We don't want language to be a barrier for people to be able to receive access to vaccines. We will take every step that we need to take to ensure that everyone who wants a vaccine will be able to get one.